It's not just gas, it's a message from your body. Have you ever let out a fart so unexpected, so sneaky, or maybe so loud, that even you looked around the room pretending it came from the chair, or the poor family dog? Let's be honest, ladies, we've all been there. Whether it's the silent puff during a family dinner or the sudden trumpet in the grocery line, passing gas has a way of showing up when we least expect it. And most of the time we just laugh, blush and move on. But here's the thing. What if I told you that some of those toots aren't just funny or awkward, they're your body's way of sending an early warning? That specific smells, sounds, or sensations can actually be telling you something important, something you shouldn't ignore? In today's video, we're diving into the 4 types of farts that senior women, especially over 60, should pay close attention to. Not to shame, not to scare, but to empower you with real, helpful knowledge about your digestive health. So take a breath, relax, and maybe crack a little smile, because this topic may sound funny, but it could seriously help you feel better, stronger, and more in tune with your amazing body. Let's get into it. Why we need to talk about this, especially after 60. Let's face it, we weren't raised to talk openly about things like gas, bloating, or digestive trouble. Especially not as women. Some of us were taught to stay quiet, to stay ladylike, and definitely not to mention anything as unglamorous as a fart, even when it hurt, even when it happened often, even when it made us worry something was wrong. But here's the truth, after 60 our bodies change. Hormones shift. Digestion slows. Foods we once loved don't always love us back. And yet, too many senior women suffer in silence, brushing off symptoms that might actually be important signals from the body. This isn't about embarrassment. This is about wisdom, the kind that comes from listening closely to our bodies, from learning what's normal, and from recognizing when something might need attention. So in today's video, we're pulling back the curtain. We're talking honestly and openly about the 4 types of farts that every older woman should understand. Because this isn't about being gross. It's about being informed, empowered, and healthy. Let's begin with the first type. Type 1, the rotten egg fart, the sulfurous stink that lingers. Let's begin with one of the most unmistakable types of gas. The sulfurous, rotten egg stink that lingers in the air long after the moment has passed. Thick, foul, eye-watering gas. You know exactly what this smells like. That thick, gag-inducing odor that hits you like a wall, makes you flinch, open windows, light a candle, or suddenly accuse the poor dog of betrayal. It's more than just a passing puff. This one stays in the air, clings to the room, and frankly, makes you wonder if your body is trying to tell you something. And guess what? It probably is. Likely causes, what's brewing in the gut. So, what causes that unforgettable smell? Sulfur-rich foods are the usual suspects: eggs, red meat, broccoli, cabbage, garlic, and onions. When digested, these foods produce hydrogen sulfide, which gives off that signature rotten egg odor. Lactose intolerance becomes more common with age. If you've noticed your tummy acts up after ice cream, cheese, or even milk in your tea, and your farts smell foul, dairy might be to blame. Celiac disease? Yes, even if you've never had an issue with bread before. As we age, our immune system can change and gluten sensitivity might show up later in life. SIBO, small intestinal bacterial overgrowth. This happens when bacteria that belong in the colon sneak into the small intestine. They ferment your food too early, creating excessive, sulfur-rich gas. Red flags to watch for. Not every stinky toot is a sign of disaster. But if this type of fart happens frequently, daily or several times a week, comes with bloating that makes your clothes feel tight, involves loose stools or diarrhea, or starts happening after meals you used to tolerate, then your body might be waving a little red flag. It's asking for your attention, not your embarrassment. Real story, Miriam's journey from blaming beans to healing her gut. Let me tell you about Miriam. She's 68. She loved her lentil soup and garlic naan, until suddenly her living room started smelling like a chemistry lab. At first she laughed it off, blamed the beans, maybe her husband's cooking. But the smell got worse. The gas became painful. She felt full after just a few bites. Her energy dipped. Finally, after a gentle nudge from her daughter, she saw a gastroenterologist. Turns out Miriam had SIBO. Bacteria were fermenting food in the wrong part of her gut. With antibiotics, some probiotics, and cutting back on fermentable carbs, Miriam felt like herself again, and her house finally stopped smelling like rotten eggs. What you can do, listen to the smell. So, what should you do if this sounds familiar? 1. Start a food and symptom journal. Track what you eat when the gas happens and any other symptoms like bloating or discomfort. 2. Look for patterns. Does dairy make it worse? What about cruciferous vegetables? 3. Talk to your doctor. especially if you're over 60 and noticing new digestive issues. 4. Request testing. A simple breath test can check for lactose intolerance or SIBO. 5. Adjust your diet. A dietitian can help you reduce sulfur-heavy foods or try a low FODMAP plan. And remember, this is not about shame. It's about information. Your body speaks through signs and sometimes it smells a little while doing it. Type 2. The loud machine gun fart. Explosive, embarrassing, and frequent. Now let's talk about the type of fart that doesn't just sneak up quietly. It announces itself. Loudly. Repeatedly. And at the worst possible time. Noisy, rapid bursts often after meals. Picture this. You're sitting quietly, maybe at a family dinner, in a prayer group, or during your favorite TV show. Suddenly your stomach tightens and pop, pop, pop. A rapid series of gas explosions break the silence like a string of firecrackers. It's not just one toot, it's a machine gun of farts, sometimes followed by a sigh of relief, and sometimes by sheer embarrassment. But here's the thing. These noisy eruptions are more than just awkward. They may be telling you something about your gut. Possible causes. What's fueling the fireworks? Excess fermentation in the gut. This means your digestive system is breaking down food in ways it shouldn't, especially in the small intestine. Gas builds up and escapes in forceful bursts. This often happens when bacteria ferment carbs too quickly. Gluten sensitivity or intolerance. Even if you've eaten bread and pasta all your life, your gut can change with age. Gluten can trigger inflammation, bloating, and excessive gas, especially loud, high-pressure farts. IBS, irritable bowel syndrome. For older women, IBS can start or worsen later in life. Loud gas is often one of the first symptoms. It's usually accompanied by cramping, unpredictable bowel habits, and urgency after meals. Associated symptoms. Listen to the whole symphony. These loud farts don't come alone. Pay attention if you also experience cramping before the gas release, bloating or a swollen belly after eating, sudden urgency to go to the bathroom, a gas that's difficult to control in public or social settings. If this kind of gas is interrupting your peace, whether at night, during meals, or in conversation, it's time to take it seriously. When to worry, disrupted daily life equals a red flag. If you're dealing with this kind of gas multiple times a day, interrupting your activities or rest, making you feel self-conscious or isolated, then don't just laugh it off. Chronic noisy gas, especially with pain or bowel changes, might indicate something deeper, and it's worth checking out. Practical tips. How to turn down the volume. Here's what you can do to reduce these gut explosions. 1. Try a low FODMAP diet. These are foods low in certain fermentable sugars that feed gas-producing bacteria. It can help reduce both the volume and frequency of gas. 2. Track your stress levels. Believe it or not, emotional stress affects your gut. Keep a journal. See if loud gas increases after anxiety, tension, or poor sleep. 3. Eat slowly and mindfully. Gulping air while eating can increase gas pressure. Try smaller bites and relaxed meals. 4. Watch for common triggers. Beans, carbonated drinks, onions, garlic, and wheat can all increase fermentation. 5. Consult a gastroenterologist. Especially if you suspect IBS, gluten sensitivity, or if gas is combined with weight loss or other red flags. Farzana's noisy dinner dilemma. Farzana, 72, always loved her dal chawal. But after every meal she felt tightness in her belly, and then came the thunder. At first she blamed spices. Then embarrassment made her avoid social meals altogether. Turns out she had a mix of lactose sensitivity and stress-related IBS. With a few simple changes, like switching to dairy-free alternatives and using mindfulness techniques before meals, she found relief. Now her dinners are quiet and peaceful. Type 3, the silent but crampy fart, the sneaky one that hurts. Now let's talk about a type of gas that's not loud. It doesn't come with drama or smell, but it leaves you clutching your belly in pain. You're sipping tea or chatting with a friend. Then a sudden twisting cramp hits you, followed by a soft release of gas. No sound. No smell. Just discomfort that leaves you wondering, what did I do wrong? You didn't do anything wrong. This is your gut waving a white flag. And it's time we talked about it. Quiet release followed by abdominal pain. These farts come without warning. They're silent, but the moment they pass your stomach feels tight, knotted, or sore. Sometimes it's a deep ache. Other times it's sharp like your intestines are being twisted. You may even feel bloated or uneasy before or after. Many women describe it as a stealth attack, unexpected and painful. What it signals? Your gut is struggling to keep up. These episodes are not just random. They're often a result of an overworked, overstressed digestive system. Here's what could be going on. 1. IBS, irritable bowel syndrome, pain cycles. IBS can cause unpredictable shifts between constipation, diarrhea, and painful gas. The silent gas with cramping is a classic sign, and it often flares up after meals, stress, or hormonal changes. 2. Hormonal gut shifts after menopause. Estrogen plays a big role in digestive health. After menopause, lower estrogen can slow digestion, increase sensitivity, and lead to irregular gas pain. That cramping isn't just in your head, your gut is genuinely reacting. 3. Emotional stress stored in the gut. Your gut is called the second brain for a reason. When you carry emotional tension, from grief, caregiving, or even loneliness, it shows up in your digestion. The gas, the cramps, the bloating? Often linked to deep, unspoken stress. You're not weak, your gut is simply overwhelmed. Please hear this clearly. You are not being dramatic. You are not fragile. Your body is simply asking for a little more care. Painful gas isn't a weakness, it's a signal. And if you've been ignoring it, this is your moment to pause, breathe, and listen. Soothing your sensitive gut. You can't always control when these episodes hit, but you can gently create space for healing. Here's how. 1. Deep breathing and relaxation techniques. Stress-tightened muscles can squeeze your gut. Just 5 minutes of slow, intentional breathing can calm the nerves that run through your digestive system. 2. Eat gut-friendly anti-inflammatory foods. Try warm, soft meals, like oats, stewed apples, soups, and herbal teas. Avoid overly spicy, greasy, or raw foods when your stomach is acting up. 3. Gentle movement and yoga poses. Simple stretches like knees to chest or child's pose can release gas and ease pain. A short walk after meals also helps reduce cramping. 4. Talk therapy or support groups. Don't underestimate how emotional support improves gut health. Talking to someone, a friend, counselor, or fellow caregiver, reduces the mental load, which lightens the gut's tension too. Nassim's healing began with a breath. Nassim, a retired teacher, kept having painful gas that hit in the middle of the night. She thought it was something she ate, but nothing helped. Finally, her doctor said, "Your body is holding in more than food, it's holding in emotion." Nassim started journaling. She added peppermint tea, yoga stretches, and gave herself permission to slow down. And within weeks, the cramps became rarer, the gas milder, and she finally started sleeping through the night. Type 4. The frequent paint-peeling fart, when something more serious might be going on. Let's be honest, we all pass gas. It's part of being human, and after 60 your digestive system gets a bit more vocal. But when those farts start becoming a daily storm, strong, foul, and constant, and they come along with other strange changes, that's your body whispering, pay attention. Chronic gas with unusual stool, weight loss, or fatigue. You're noticing more gas than usual. Not the occasional puff, but persistent, paint-peeling gas several times a day. And it's not alone. Your stool looks different, maybe thinner, darker, or looser than normal. You've been losing weight without trying. You're tired all the time, even after resting. This isn't just uncomfortable, it's a pattern. And patterns in our health are never random. They're messages from within. Health concerns, what this kind of gas may be telling you. These symptoms together, the gas, the changes in bowel movements, the fatigue, could point to underlying digestive or colon conditions. Here's what doctors want senior women especially to know. 1. Colorectal cancer, especially after 60. One of the first signs of colorectal cancer can be chronic, foul-smelling gas. As tumors grow, they can block normal bowel function, leading to gas buildup, odd stools, and discomfort. Many women ignore this, thinking it's just age or diet or hormones. But colorectal cancer in women is more common than many realize, and early signs often get brushed aside. 2. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis cause chronic inflammation of the gut lining. This leads to bloating, cramping, frequent gas, diarrhea, and even bleeding in some cases. It's not just about food, it's an autoimmune condition and it deserves proper care. What doctors say, when testing is necessary. Doctors aren't trying to scare you, they're trying to protect you. And here's what they recommend if you notice the following symptoms. Gas that smells worse than usual multiple times a day. Unexplained weight loss. Changes in bowel habits lasting more than a few weeks. Visible blood or dark tar-like stool. Fatigue that doesn't go away. Pain that keeps returning in the same area. In these cases, your doctor may suggest a colonoscopy. stool test, blood work, a CT scan or other imaging. And here's the truth. Most of these tests are quick, simple, and life-saving. They're not meant to frighten you, they're meant to give you peace of mind. Early detection saves lives. Let me be clear. Having frequent gas doesn't automatically mean you have cancer or IBD. There are many benign causes too. But when your gut is acting up in a new and persistent way, it's always better to ask, check, and be sure. Because early detection changes everything. Caught early, colorectal cancer has a 90% survival rate. IBD can be managed beautifully with medication and diet. Even small issues like bacterial overgrowth, food intolerance, or digestive imbalance can be corrected, but only if they're acknowledged. Farzana ignored it, until her daughter made her see a doctor. Farzana was 72 when her daughter, Amina, noticed something was off. She had always been bubbly, sharp, and full of energy. But over the last 6 months she'd lost weight, kept clutching her stomach, and began excusing herself from social events. She blamed it on gas. Said it was the lentils or the new brand of oil. But it wasn't. After much convincing, Amina took her to the doctor. A simple stool test and colonoscopy revealed a small tumor, caught early. Treatment began immediately. Today Farzana is back at the park, laughing, eating her favorite foods, and most of all, grateful that she listened when her body was speaking. You deserve to know, not to wonder. Gas is not shameful. It's not something to hide, ignore, or joke away. It's a natural part of life. But when it changes, when it becomes something new or constant or different, that's your body gently saying, please, look closer. And when we listen early, we protect the life we've worked so hard to build. Comment the word, listen, if you believe our bodies always try to tell us something important. Let's take a quiet moment here. If what you've heard so far is making you think differently about your health, if you're beginning to realize that even something as awkward as gas might hold a deeper message, then you're not alone. Thousands of women are walking this same path, quietly wondering, quietly suffering, and finally choosing to listen. And if this video is helping, even a little, please consider subscribing to our channel. We talk about all the things others are too shy to discuss. Because you deserve truth, clarity, and comfort without judgment. Let's keep this conversation going. You matter, and so does your health. Your body deserves your attention, not shame. Let's be honest, we've all had a moment when a sneaky, loud, or stinky fart caught us off guard. We've laughed, we've blushed, we've blamed the dog or blamed the beans. But here's the truth. These aren't just awkward moments. They're your body's way of whispering, sometimes shouting, hey, something's going on in here. After 60, it's not about chasing perfect health. It's about staying aware, staying informed, and staying compassionate toward yourself. So if you've heard something today that made you think, something that made you chuckle and pay attention, then you've taken a step in the right direction. Listen to your body. Learn what it needs. Live better, with confidence, not confusion. And if this video helped you in any way, please like, comment, and share it with a friend. Because sometimes, a little laughter and a little truth are all we need to feel less alone. Thank you for spending this time with us here on Wisdom in Old Age. Until next time, take care of yourself. Your body is always speaking. Now it's time.